Hello, I'm Jean Damour Harigosenga. I'm going to present to you the project called Coding for the Board, which I'm working on in my College for America courses. In this project, I'll be talking about healthcare essential, the purpose and benefit of healthcare essential, what is healthcare accreditation, the purpose and benefit of healthcare accreditation, differences between essential and accreditation in healthcare, the purpose, the mission, and the key initiatives of the Joint Commission, the purpose, mission, and key initiatives of NSKA. Then I will also talk about the purpose, the mission, and key initiatives of the Health and Medical Division of the National Academies of Science, Engineering, and Medicines. I also talk about the purpose, mission, and key initiatives of the U.S. Department of Health and Human Services Agents for Healthcare and Quality. I also talk about Centers for Medicine and Medicaid Services quality initiatives. I will also talk about the role and significance of EOMS to err is human. I also talk about the role and significance of EOMS crossing the quality chasm, the role and significance of ARRK, National Strategy of for Quality Improvement in Healthcare. I also talk about SMS, Nursing Home Quality Initiative, and also Nursing Home Compare website, then come up with conclusion. Let's begin with what is healthcare essential. First of all, essential, this is the process by which the government authority gives permission to an individual, practitioner, or a healthcare organization to operate or to engage in a profession. Healthcare organization essential is granted the following on an on-site inspection to determine if minimum health and safety standards have been met. Let's see the purpose and the benefit of healthcare essential. Essential provide the permission from the states to do something that would be illegal without a license, protecting the public health and safety. It reduces the risk of closure or no reimbursement to the employment that serves Medicare and Medicaid. Let's see what is healthcare accreditation. First of all, accreditation, it is a formal process in which an recognized non-government organization assesses and recognizes that a healthcare organization meets applicable, predetermined, and published standards. Let's talk about the purpose and the benefit of accreditation. It stimulates and improves the integration and the management of health services. It also encourages continuous improvement efforts within accreditation organization. It reduces healthcare costs by focusing on increased efficiency and effectiveness of services. It strengthens the public's confidence in the quality of healthcare organization. It reduces risk associated with injury and infections for patients and staff. Let's talk about the differences between essential and accreditation in healthcare. Essential, it exists primarily for public safety and the well-being of consumers, while accreditation, it is both a process of accreditation. For essential, it is typically involuntary, while accreditation, its process is voluntary. For essential, individuals, organizations, facilities, or agencies can be licensed, but for accreditation, only organization, agencies, or program can be accredited. Let's see the purpose, mission, and key initiatives of the Joint Commission. Joint Commission, this is an independent, not-for-profit group which administers voluntary accreditation programs for hospitals and other healthcare organizations. The purpose of Joint Commission is to help the healthcare organizations and the programs to get accredited or certified. Its mission is to continuously improve healthcare for the public in a collaboration with other stakeholders. A Joint Commission accredits different types of organization what you can call incentives in other words uh, include nursing homes and other long-term care facilities, behavioral health care organizations, and addiction services, home care organizations including Medicare and KidCo access hospitals. It also certifies the services offered at healthcare organizations such as disease-specific care certification, certification for healthcare staffing services, and advanced certification in disease-specific care and palliative care. Its initiative is providing home care services. Let's see key initiatives of Joint Commission. As we have said it before, let's move on what is NCKA. As you are seeing here on these pictures, have better healthcare, better choices, better health. Then let's go on the purpose and mission and key initiatives of National Committee for Quality Assurance. First of all, this is the National Committee for Quality Assurance that aims to improve the healthcare quality. Its mission is to improve the quality of healthcare, while the purpose is to study how well health plans and doctors provide scientifically recommended care to their clients. Key initiatives include HADIS and using measurement, transparency, and accountability to highlight top performers and drive improvement. Let's see the purpose, the mission, and key initiatives of the HMD of the National Academies of Science, Engineering, and Medicine. The Health and Medicine's vision is a division of the National Academies of Sciences, Engineering, and Medicine. Its purpose, it is there to provide independent, objective analysis and advice to the national and conduct other activities to solve complex problems. Its mission is volunteering more than 3,000 individuals each year and time knowledge through the work of HMD. Key initiatives helping the private and government and in private sectors to make informed services. Let's see Agents for Healthcare Research Quality, which lead federal agents charged with improving the safety and quality of Americans' healthcare system. Its purpose is to make the healthcare better and safer for today and tomorrow. Its mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work within the U.S. Its key initiatives is to develop the knowledge, tools, and data needed to improve the healthcare system and making informed health decisions. Let's see Centers for Medicare and Medicaid Services quality initiatives. Its purpose, first of all, this is a quality healthcare highly priority department of health and human services, which stands for improving the quality and improvement of health. Its mission is assuring quality health care for all Americans through accountability and public disclosure. Its initiatives is focusing on public reporting quality measure for nursing, home health agencies, hospitals, kidney dialysis facilities. Let's move on the role and significance of ERM to err is human. First, let's see what is preventable medical error. These are the mistakes which are done by doctors or other healthcare professionals, which can bring a negative impact to the patient's life. Example of medical errors: too many blood transfusion, too much oxygen for premature babies, healthcare associated infections, medication errors, poor communication, lab errors, pharmacy errors, etc. Problems of preventable medical errors. Between 44,000 and 98,000 Americans die each year in the US due to preventable medical errors. Let's continue with problems of preventable medical errors. According to the Health Grades 2004, about 5,000 Americans die a year due to preventable errors. 500 patients die as a result of preventable medical errors in the US hospital. Because of these medical errors, the US government throws approximately about 37.6 billion each year, whereby $17 billion of those money are associated with preventable errors. As a conclusion to this problem, the healthcare professionals have to pay attention with delivering the medicines. They have to do their best to reduce these medical errors. Let's see the role and significance of ERM to error is human. It helps in reducing the error done by the doctors within hospitals, protecting the patients from being harmed by healthcare system that is supposed to offer healing and comfort them. It helps in designing the health system at all levels, which make it safer to make it harder for the people to do something wrong and easier for them to do something good. Developing the methods for educating consumers about patient safety and recommended additional improvement. It's also let's see the role and significance of ERM crossing the quality chasm. This is the healthcare system that has the role of supporting payment and regulatory environment, designing imperatives, or designing care delivery, such as the engineered care processing, effective use of information technology, coordination of care across patient conditions, services, and sites of care over time. It has the 6 aims to improve the quality of health care, which are safe, effective, patient-centered, efficient, equitable, and timely. It reforms health professionals' education and also encouraging information technology implementation, which improve the capability of an electronic health record. Let's see the role and significance of IHRK, a National Strategy for Quality Improvement in Healthcare. This is the National Strategy for Healthcare Improvement in Healthcare, which has a role in providing better, more affordable care for the individual and the community. It also has the role in providing a focus for addressing the abundance of clinical quality measures, which are most used in the national program. Its goal is to get 2 measures that matter and minimize provider burden. The incentives are making sure that there is a better care, health people, health community, and affordable care. Let's see SMS, Nursing Home Quality Initiative. Nursing Home Quality Initiative is very important in people's life as it improves quality of life and quality of care for residents. To provide information regarding the quality of care in nursing homes. A nursing homes quality initiative helps the patients to get treatment without any difficulties in their home. Here is a picture showing star ratings, where more than 1/3 of all US nursing homes have overall ratings of 1 or 2 stars, accounting for 39% of all nursing home residents. You can see it here on this picture. Let's go on with criteria of which SMS used to determine the 5-star criteria. We have health inspections, health inspections, health staff measures, and quality measures. Let's see nursing home compare website. Nursing home, this is the place where the people who can't be cared at home on 24-hour nursing care are treated. It helps you to find and compare nursing homes certified by Medicare and Medicaid. It provides the information on nursing home, which can help you to learn how nursing homes have performed on health and fire safety inspections. It helps to learn how nursing home care for their residents. It allows consumers, providers, states, and researchers to compare information on nursing homes. As a conclusion, nursing home is a place where other people who don't need to be in a hospital are treated and cared for 24 hours a day. As nursing home quality is a serious issue, nursing home residents tend to have significant limitations like functional or cognitive limitations and multiple clinical conditions. As preventable medical errors kill many people every year, the hospitals are urged to use the very skilled healthcare professionals who will contribute in reducing the medical errors. Thank you so much. If you want to read more about all the topics that you have talked about, you can access those references. So the links where you can open and learn more. These are references, 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 and references.